Hello, I'm John Molesky, and this is Wilson Center Now, a production of the Woodrow Wilson International Center for Scholars. My guest today is Valerie Percival. Valerie is a fellow with the Wilson Center's Maternal Health Initiative and the Canada Institute. Val is also an associate professor at the Norman Paterson School of International Affairs at Carleton University in Ottawa, Canada. Among her other credits, she's a commissioner for the Lancet and the Swedish Institute for Global Health Transformation Commission on Peaceful Societies through Health and Gender Equality. She joins us today to talk about her Wilson Center research. Her project is titled Promoting Gender Equality and Health Equity Through Foreign Policy, Panacea or Fool's Game. Val, welcome. Thanks for joining us.
Thanks very much for having me, John. It's a pleasure to be here.
So let me ask you first to explain this basic concept of your research, the idea of foreign policy with this particular focus. How would this be different than the way foreign policy has been routinely practiced by many countries around the world?
Well, so first, I'd just like to take us a step back. So through our Lancet Commission research, we found some credible evidence that improvements in health equity and improvements in gender equality really place societies on pathways to peace. So there's compelling evidence of the relationship between gender equality and more peaceful societies, as well as health. And I think that foreign policy decision makers have often seen health as kind of an outcome of social processes and political processes, rather than something that can act independently to influence the dynamics of peace and conflict. And so I think that's the value added of our research, and that's what makes it a little bit different. We're basically saying gender equality and health equity are important investments on their own, but it's also important in terms of helping make societies more peaceful as well as more resilient.
And so how does that work on a practical level? So say you are formulating foreign policy from country A to country B. What would be the conditions that would highlight these two priorities?
Well, I think that the first thing that I think that's important to recognize is that gender equality and health equity can't be built through rhetoric alone. So we can't just talk about societies being healthier or equality between men and women. We need to ensure that we actually invest in the mechanisms to improve health outcomes and the mechanisms to improve gender outcomes. There was a report that was released yesterday from the Auditor General in Canada that suggested that despite a lot of investments in gender equality, we haven't seen those kind of concrete outcomes, in part because we haven't invested in things like education systems with monitoring of outcomes. We haven't sufficiently invested in healthcare and health systems, looked at how laws are structured, infrastructure, engagement in the economy. So that's kind of the mechanics of improving health equity and gender equality. And what we argue in our report is that through those improvements, societies improve their human capital, the economic growth becomes more inclusive, social capital improves, social norms are transformed, and there's also compelling evidence that societies that have higher levels of gender equality and health equity have improved political governance and lower levels of corruption. So it's not health and gender per se, it's the social, political, and economic processes that those improvements trigger that enable societies to be a little bit more peaceful.
When you talk about the studies and what they indicate, what are some of the countries that are doing well in this area?
Well, that's a challenging question in today's world. So the case studies that we looked at, I think one is particularly interesting because it shows the differences between parts of the country that are doing well and parts that aren't. So Mozambique is one of our case studies, and it's a place where I've spent several years. And we also have a project in northern Mozambique in the Cabo Delgado region. And one of the things that's really fascinating about Mozambique is that they have this really dynamic gender equality movement, a lot of focus on health equity, and particularly in the south of the country, you haven't had conflict since the conflict ended in the mid-90s. However, in the north of the country, where you have the lower levels of gender equality, lower levels of health equity, you're seeing this insurgency that is displaced approximately 1 million people and led to a lot of hardship in Cabo Delgado. So that's one of the areas that one of our case studies that we looked at that shows this difference between the North and the South. I think one of the other things that I think is important to emphasize is that we talk in the report about the importance of inside out transformation. So gender equality is not, and health equity is not something that can be necessarily forced from the outside. And particularly with external actors advocating for gender equality, you can experience backlash. And so I think that it's really important that we focus on these inside out processes and enable countries to determine how they want to proceed with gender equality and enable activists and civil society and organizations to shape that agenda.
The types of disruptions that affect societies and create things like refugee crises.
Yes.
We've just lived through a couple of years of one shared experience, the global pandemic.
Yes.
And am I correct to say that what we've seen is that women are disproportionately affected during a health crisis?
Yes, I think that women and girls, adolescent girls, are disproportionately affected and differently affected. So I think what we saw in the COVID pandemic, in terms of mortality, I think it's important to emphasize and acknowledge that through many countries in the world, men had a much higher mortality rate, and also in part because of biological factors, in part because of the kinds of occupations. A lot of men continued to work and were potentially more risk acceptance than some women in terms of navigating the risks of the pandemic. I think where we saw women and girls much more affected was in terms of caregiving, in terms of choices to exit from the formal economy. I think that we also saw in some countries shutdowns of schools that lasted an extremely long time. And a lot of evidence has suggested that when schools begin, it's the girls that are often the ones that are not going back to school. So we did see increased rates of early child marriage during the pandemic. And yes, it was a really challenging setback for gender equality. And I think it's also been a really challenging setback in terms of economic progress more generally. And I think we'll see also, the challenges of economic strain on gender equality outcomes and health equity outcomes as well.
One of the things that you mentioned essentially speaks to women still in the role of sort of the homekeeper, whatever that means, whether it's providing daily care to members of the family or upkeep of the household. So I wonder, when we look at the equation for equality, how much of this is a matter of culture, where women are still often finding themselves in a subservient role?
Yes, I definitely think that social norms that see caregiving primarily as a female responsibility within the household are important in terms of determining the impact of a pandemic or other forms of social disruption on women. I do think that social policy and economic policy also play an important role. One of the interesting
But
studies.
are they reflections of that, Val?
Yes, they are. But I also think that it's important for us to push back against those cultural roles in our policy. I think one of, this is an example from Canada, But one of the things that I thought was particularly interesting in my home province of Canada was that you had a continuation of construction ongoing, which is a primarily male domain, and yet things like hair salons and nail salons, where you saw a lot of female entrepreneurs who owned them, were shut down. And it's unclear to me how the risk differential was different. And so I think we do need to push back against gender biases in policy. And I think we need to point them out. And hopefully in future pandemics, we won't see the same kind of unbalanced impacts according to gender.
While we're on this track of barriers, with cultural biases
Mm-hmm.
being one of them, what are the other major barriers we're talking about here? Is it political will? Is it financing? Is it ability to invest in things like education? What are the main barriers that you've uncovered?
I think in terms of cultural barriers, I think one of the things that's really interesting, we did some studies on the humanitarian sector and on perceptions of gender in the humanitarian sector. It's fascinating when you start to look at the language and you look at how women and girls are characterized in the humanitarian context. So you see them and of course the sexual and gender-based violence definitely disproportionately impacts on women and girls and needs to be called out. But I think that if you're only portraying women and girls as victims, and instead of focusing on their agency and the fact that they're leaders in their communities, that they enable their families and their communities to navigate crises, natural disasters, conflicts, when you characterize women and girls as victims rather than as agents and as leaders, I think that that has a subtle impact in terms of how you characterize policy, how you frame policy. The other thing that I think is important to point out is that the health sector itself has very deep gender biases. So if you think about who leads the health sector, it's often disproportionately led by men, even though the vast majority of health workers are women around the world. And so some decisions are made in terms of understanding gender barriers to accessing healthcare services, how women and girls are treated within healthcare facilities that haven't really sufficiently been addressed in the healthcare system more broadly. And so that's another thing that we call out, just these implicit biases that we need to be aware of when we're developing policy.
And what do the trend lines indicate around these various things that you've been talking about? Are we seeing significant progress, halting progress, backsliding? What is the circumstance?
I'm very concerned about backsliding. I'm very concerned about backsliding for two reasons. I think the first is the long tail of COVID and the impact that COVID has had. You know, we have some countries where girls were out of school for a significant period of time, a year and maybe even longer, and the lost potential in terms of education, and the fact that some of those girls were then forced into marriage or chose to marry and didn't continue their education. I think that generally we're seeing a challenging economic context. I worry about investments in gender equality and health equity, particularly when we see in foreign policy a rise in a discussion of national security priorities, be them economic security or military security. Rights-based discourses like gender equality and health equity often don't fare well when you have a securitized foreign policy discourse, and that's one of my concerns.
We've mentioned it directly and indirectly more than once in our discussion: education.
Yes.
How is this a significant linchpin in this equation?
Yes.
If you can up the access to education and create equality there, do a lot of other dominoes begin to fall into place?
Yes, absolutely. Education is critically important. And I think that when it comes to adolescent girls, I would add sexual and reproductive health and rights is also being critically important. We know that the economic benefits of ensuring that adolescent girls have access to comprehensive reproductive health programs that both provide contraceptives and also teach them agency and how to interact in challenging social situations, have huge dividends. We know that when girls are allowed to go to school and when they're allowed to stay in school, the completion rate is really high, and it's very challenging to stop girls once they are educated. So definitely education is a key component to any gender equality discussion and health equity discussion. I would also emphasize that we need to talk about not just high school, not just primary education or secondary education, but beyond tertiary education as well.
Val, is there a model nation that has used best practices in this regard when it comes to crafting foreign policy?
Oh, that's a challenging question. I think that every country has strengths and weaknesses in terms of their foreign policy. I think that Sweden is a really interesting example. They were the first out of the gate in terms of a feminist foreign policy. And, I've had students that have examined and compared Swedish approaches with Canadian approaches in terms of the implementation of gender equality measures on the ground. And I think that one of the things that's clear is that Sweden has a much more kind of comprehensive approach and tries to really address all of the factors that are causing and contributing to gender inequality. I sometimes, in terms of foreign policy approaches, as I mentioned earlier, virtue signaling or just rhetoric around gender equality isn't going to improve gender outcomes. I use the phrase, you can't just sprinkle feminist fairy dust around the world and expect these outcomes. You need to focus on the mechanisms of gender equality.
No matter the issue, talk is cheap, right?
Yes, exactly.
Lech Wałęsa said, "Let actions follow words now," when he spoke to the U.S. Congress many years ago. I know sometimes this is just creative license, but the working title of your research project, talk to us about the Panacea versus or fool's game question.
Yes.
What are you invoking with that?
So I wrote this proposal after the Taliban took over Afghanistan, and Afghanistan was one of our case studies for the Lancet Commission, and I had two extremely talented master's students who were of Afghan origin who worked on the case study. And I think that Afghanistan was a heartbreaker for so many of us who saw the importance of focusing on gender equality in a context like Afghanistan, but also saw that the way that that gender equality initiatives were rolled out, the politicization of gender equality, the instrumentalization of gender equality, really in some ways undermined the long-term well-being maybe of Afghan women. And so that's where the title came from. There is such convincing evidence that gender equality is good for societies, it's good for the economy, it's good for politics, and it's good for peace. And yet it's very challenging to understand the best path forward, how to get there. And hopefully some of the research that we've done will help nudge forward that conversation.
And my final question is about your ongoing research. What is there a particular form that this research at the Wilson Center will take? Will it be a paper or a report? And how people who are interested in following this, is there a place they can look to for more information?
Yes, so I'm hoping that we will have a report available at the end of June. We're also hoping to have an event surrounding that report. And it will look specifically at the issue of backlash and compare Canada and US foreign policy. And the best place to look for that would be the Maternal and Child Health Initiative, as well as the Canada Institute websites at the Wilson Center.
Great. Well, Val, thank you very much for a terrific interview and lots of great information, and continued success to you as you keep working on this important topic.
Thank you so much for the opportunity and for your time.
Our guest has been Valerie Percival, and we hope you enjoyed this edition of Wilson Center now, and that you'll join us again soon. Until then, for all of us at the Woodrow Wilson Center, I'm John Molesky. Thanks for your time and interest.